Assalamu alaikum. I am Dr. Rowshon Ara Begum, Assistant Professor, Department of Forensic Medicine and Toxicology, Bangladesh, Bashundhara Ad-din Medical College. Today, our continuation from the topic medical negligence. As mentioned before, the extent of liability measured in case of doctor is the loss of earning, that is absence or due disability. Expenses incurred, reduction of expectation of life, reduced enjoyment of life, that is loss of limb or loss of sense, loss of potency, aggravation of pre-existing conditions such as the disease was dormant becomes existing now, and even finally death. Doctors are not liable in such cases such as an error of judgment or diagnosis if he is secured all necessary data on which based the judgment is done. For failure of cure or bad results that follow if he exercised reasonable care and skill, there will be no willful negligence. If he exercises reasonable care and skill provided his judgment confirm accepted medical practice and does not result to failure to do something or doing something contrary to accept the medical practice. These cases the doctors are not liable. So, which cases the doctor are liable? The cases there is usual and normal practice, but the practice is not adopted. The practice adopted that no professional man or ordinary skill will be taken. Medical negligence is a culpable carelessness in the field of medical science that causes risk to health and well-being of an individual who entrusts his well-being into the hand of the medical practitioner or medical profession, that is the doctor. Nowadays, people are comparatively much more aware regarding his treatment or management and also know the fact that medical negligence is occurred during this treatment process. So, patients and the doctors both must be aware of such fact. A person who alleges medical negligence against a doctor must prove 4 elements, that is termed as 4D. One is duty, that is a doctor should have a duty in the process of giving the care. Number 2 is dereliction of the duty, that the doctor did not meet the standard of care or violation of standard of care, that is the breach of the duty of care. Number 3 is direct causation, that is the damage or injury that is caused by breach of the care is direct by the doctor. And finally is damage. A result, patient has suffered injury or loss directly from the doctor. These following conditions are necessary to form a case such as damage is solely due to the negligent act based on evidence given by the experts or the evidence speaker from itself, like as including the swab or instrument left in the operative field, like as swab or instrument left in abdomen. Number 2 is patient have not contributed to his own damages, that is the patient is not responsible for contributory negligence. Defendant doctor solely responsible for the damage as the damage has been occurred by his own hand. And finally, civil litigation is initiated by patient against the doctor in a civil court. The limitation period is 2 years. So, for medical negligence to be proven, there must be a breach of standard of care either by commission, that is doing something, or omission by failing to do something. It is an issue of serious human rights concern that directly affects right to life and right to health care of a person. The overwhelming number of incidents of the medical negligence mostly goes without any legal actions regarding in our country, leading to frustration situation where public trust is completely lost in the medical service providers, that in case of medical professionals in our country, like entrusting the doctor, nurse or even medical men. Some preventive measures should be taken in this fact, such as establishing a good rapport with patient and the colleague, otherwise the patient or other colleagues will not entrust the doctor. Be rational in case of diagnosing and managing the disease or even the problem which is concerning the patient. Keep full, accurate and legible medical records, otherwise there will be no defense from the part of the doctor against these actions. Do not criticize any member of treatment team in front of the patient, as they all are colleagues in this matter. Obtain informed consent of the patient, that is very vital point in case of physical assault as well as criminal assault, as well as treating each and every individual patient. Identify and inform the risk of the problem to the patient and also the medical teams regarding this fact, and also manage and treat the risk. Inform all about the conditions, the alternative prognosis, and even other ways regarding this issue. Never guarantee a cure, because a doctor cannot guarantee a cure of the problem. There may be many other mal-occurring or even malfunctioning. Complications should be found out and treated properly. Respect of patient's attitude and autonomy must be regarded as it is a part of Geneva Declaration, which all doctors are taken as a Hippocrates oath. Treat and care with compassion, dignity, empathy. Take a humanistic approach regarding the treatment to the patient who has come in contact. Establishing hospital injury prevention program, that the hospital injury program prevention department will include all the facts, all the issues and all the concerns regarding these negligence cases. Maintaining continuing medical education program as well as continuous professional development, that is termed as CPD. Participation in case of medical legal cases regarding these issues, as medical legal seminars involving the all sectoral groups, medical groups, legal groups, as well as the patient party groups or as a public. So, in these seminars, the fact will be regarded as doctor-patient relationship, medical negligence, professional infamous conduct like others, vicarious liability, res perquisitum, all these facts that involving the doctor-patient relationship vitally and importantly, as such as these preventive measures can involve and treat the conditions that are hampering the doctor-patient relationship, and also in future the treatment plans and the improvements from these treatment plans, so that the doctor as well as the patient will be aware and find remedy of these problems as well as the issues. That's all for today. Thank you. Assalamu alaikum.